Hello and welcome. Today, we're diving deep into a fascinating and sometimes perplexing heart condition known as sick sinus syndrome. This isn't a single disease, but rather a cluster of heart rhythm problems originating from the heart's natural pacemaker, the sinus node. Join us as we unravel the complexities of sick sinus syndrome, exploring its causes, symptoms, diagnosis, and management. So, what exactly causes sick sinus syndrome? The primary culprit is damage or scarring to the sinus node itself. This damage can stem from a variety of factors, including aging, underlying heart conditions like coronary artery disease or heart failure, high blood pressure, inflammatory diseases like rheumatic fever, certain medications such as beta blockers or calcium channel blockers, and even genetic predispositions. Sometimes the exact cause remains a mystery, highlighting the complex nature of this syndrome. To understand sick sinus syndrome, we need to delve into the heart's electrical system. The sinus node, located in the right atrium, is responsible for generating electrical impulses that control the heart's rate and rhythm. In sick sinus syndrome, the sinus node malfunctions. It might fire impulses too slowly as bradycardia, too quickly as tachycardia, or in an irregular fashion. This can lead to periods of alternating fast and slow heart rates, known as tachycardia-bradycardia syndrome. Ultimately, the heart's ability to pump blood efficiently is compromised, impacting overall health. While sick sinus syndrome can affect people of all ages, it's more commonly seen in older adults, typically those over the age of 50. The exact prevalence is difficult to pinpoint, as many individuals may experience mild symptoms or remain undiagnosed. However, it's estimated that sick sinus syndrome accounts for a significant proportion of pacemaker implantations, highlighting its clinical importance. Its occurrence is not significantly biased towards one gender or race. The symptoms of sick sinus syndrome can be quite varied, depending on the specific heart rhythm abnormalities present. Common symptoms include fatigue, dizziness, lightheadedness, shortness of breath, palpitations, a feeling of skipped heartbeats or rapid fluttering, chest pain or discomfort, fainting or near fainting spells, a syncope, and confusion or memory problems. These symptoms can come and go, making diagnosis challenging. It's important to note that some individuals may experience no symptoms at all, especially in the early stages. Diagnosing sick sinus syndrome requires a thorough evaluation by a cardiologist. The process typically begins with a physical exam and a review of medical history. An electrocardiogram, or ECG, is crucial for recording the heart's electrical activity. However, because the rhythm abnormalities can be intermittent, a standard ECG may not capture the problem. In these cases, longer-term monitoring devices like Holter monitors, worn for 24-48 hours, or event recorders, worn for weeks, may be used to detect the abnormal heart rhythms. An electrophysiology study, an invasive procedure, may be performed to directly assess the sinus node's function. Sick sinus syndrome doesn't have strict classifications, but it can manifest in different ways. The most common variations include sinus bradycardia, an abnormally slow heart rate, sinus arrest or pause, periods where the sinus node stops firing altogether, sinoatrial block, delayed or blocked electrical impulses leaving the sinus node, and tachycardia-bradycardia syndrome, alternating periods of fast and slow heart rhythms. Recognizing these patterns is key to tailoring the right treatment approach. Treatment for sick sinus syndrome focuses on managing symptoms and preventing complications. For individuals with mild symptoms, lifestyle modifications, such as avoiding triggers like caffeine and alcohol, may be sufficient. However, for more severe cases, a pacemaker implantation is often necessary. A pacemaker is a small electronic device that's surgically implanted under the skin and connected to the heart via wires. It monitors the heart's rhythm and delivers electrical impulses when needed to maintain a normal heart rate. Medications, such as antiarrhythmics, may be used to control episodes of tachycardia, but they must be carefully monitored. Importantly, medications that may be worsening the condition may have to be ceased or have their dosages adjusted. Unfortunately, there's no definitive way to prevent sick sinus syndrome entirely, as many cases are linked to aging or underlying heart conditions. However, maintaining a healthy lifestyle can significantly reduce the risk. This includes managing blood pressure and cholesterol levels, eating a heart-healthy diet, exercising regularly, avoiding smoking, and limiting alcohol and caffeine intake. Regular check-ups with a healthcare provider can also help detect and manage any underlying heart conditions that may contribute to the development of sick sinus syndrome. The prognosis for individuals with sick sinus syndrome varies depending on the severity of the condition and the presence of other heart problems. With appropriate treatment, particularly pacemaker implantation, most people can live normal, active lives. Recent research focuses on improving pacemaker technology, such as developing leadless pacemakers and optimizing pacing algorithms to better mimic the heart's natural rhythm. Ongoing studies are also exploring the potential role of gene therapy in treating certain types of heart rhythm disorders, offering hope for even more effective treatments in the future.